Good to see you again. Let's talk Unit 11, where we are going to discuss common diseases of cattle. This is going to be a 4-part mini-lecture series in order to get all these in kind of a shortened time frame of about 10 to 12-minute lectures each one of these. So let's get to our content here and talk about cattle diseases. Making an appearance again is foot and mouth disease, and you'll see a lot of repetition on this slide. Not going to belabor this one as we discussed it in the same vein in the swine section. Just a couple of reminders. This one is extremely problematic. It's a great thing that we've not really had an outbreak in most of a century. But should you have one that is suspected and you contact your veterinarian, they are going to immediately contact the state veterinarian and then in turn the United States Department of Agriculture, because this is one that is high on their list in terms of monitoring transmission and risk. Certainly take note, although this would be highly unlikely and very rare to occur anymore in the U.S., you would want to know what the symptoms of foot-and-mouth disease are, but very likely you'll never encounter it. Next, let's talk bloat. Bloat is non-contagious. It's an accumulation of gas that happens in the rumen. Can be really acute, meaning very, very problematic right away, or chronic. You can have steers or something that kind of just bloat over and over again. Causes is typically feed, environmental, but it's an excessive gas accumulation in the stomach. Usually, if you think about bubbles in a bubble bath, the air is inside the bubble, and that can also happen within the rumen, especially when they maybe ate too much grain, maybe turned out on very, very lush legume pasture like alfalfa. They can get really a lot of frothiness within the rumen, and therefore that gas just expands in the rumen and causes a lot of discomfort and potential problems for them. You'll see it signified by a distension or an extension of the left side of the cow. They'll probably stop eating and move in a really stiff and uneasy fashion. If it gets really bad, the more gas that builds up, it puts a lot of pressure on the diaphragm and they have trouble breathing. They may start grunting, they may slobber, and eventually have trouble standing. And you do not want them to lay down, because now you're putting them in the proverbial rock and a hard place situation where you've got lots of gas buildup on the left side and they will probably lay down on the right side, so now you have a hard surface on the right side. They'll have difficulty breathing. So it can, in fact, cause death, and they basically die because they can't breathe or asphyxiate. So how do we prevent it? So reduce or eliminate the causative agents. So something, again, feed-related most of the time. Avoid turning cattle out on straight legume pastures. Use a little bit of dry hay if you're feeding grain. Always have water available. That's a common thing all the time. And then treatment. Prompt treatment is typically essential. But the best things right away, if you notice it, and if you're needing to call your veterinarian, keep that animal walking. Tie them if you can. If they're able to be restrained, tie them with their head up so they can't lay down. And then if it gets worse and you understand what you're doing, you may have to have your veterinarian train you, but pass a hose into the stomach, down the esophagus into the rumen, and that will help alleviate some of the gas. And then there's a process called trocar and cannula, which is just basically you are passing a sharp object into the rumen cavity and then pulling it out with a cannula left in there, and that will help the gas expel. And then finally, you'll want to support them with some penicillin treatment. Next, and kind of loosely related here, is traumatic reticulitis or hardware disease. And this is where we've got some mechanical injury caused in the reticulum, oftentimes associated with the ingestion of nails or screws or a piece of wire that would poke through the reticulum and therefore cause lots of discomfort. Animals that have hardware disease probably are anorexic, are probably slow movers, often milk, have a few other symptoms that go along with it that you can see on the screen here. So how do we prevent it? Well, of course, good maintenance around your facilities and pastures is really, really critical. If you're feeding a TMR, make sure that your TMR has a magnetic strip on the discharge chute that would happen to catch any metal objects that might be in there. And then lastly, you can administer a small bar magnet. It's about the size of an Expo dry erase marker that you shoot down their esophagus that will reside basically permanently in the reticulum, and that will magnetically catch any foreign objects that get in there. If you detect and diagnose properly hardware disease, antibiotics will help them because you have an active infection potentially going on. Surgery, if it's warranted on the animal, might be a possibility. But hopefully you're working to prevent peritonitis, which we will cover later on, and pericarditis, because the reticulum is located right next to the heart, and sometimes that sharp object can poke through and damage the pericardial sac, and therefore cause an infection there. Next disease is impaction, and this is usually caused by access to large quantities of grain. So just like if I had the opportunity to eat a whole bunch of M&Ms, I would love getting them down, but they're probably going to cause me a stomach ache later on. And so rapid fermentation then causes excessive levels of lactic acid, which slows down the muscular movement of the gut, in the small intestine especially, and so you'll get kind of a roadblock, so to speak, in the small intestine. Symptoms of this one, and symptoms and signs are very tightly related here. You'll have a bunch of different things that could go on. They could have diarrhea, they could grind their teeth, they could be dehydrated, even short stints of blindness. But basically, treatment and prevention, a little bit of sodium bicarbonate, and that helps even out the rumen pH a little bit and get them back going again. Potentially some penicillin, and then administer some mineral oil in order to stimulate muscle movement, and that would need to be done via bottle or tube fed. Next is acidosis, and somewhat related to the last disease that we talked about there, because this one is also very feed related. If you get an animal that slug feeds a whole bunch of grain at a time, that causes a dramatic and drastic change in rumen pH. Normal rumen pH should be around 6.3 to 6.8 in the rumen, and if we feed them way too much grain, especially corn, we may drop that rumen pH by a whole point to a point and a half. What that does is kills a bunch of the rumen bugs that are helpful in digestion, and therefore creates a lot of problem and pain and discomfort for the animal. Symptoms of this one are signs. You'll see abdominal pain, so they'll kick at their stomach. Profuse, bubbling, smelly diarrhea. It looks like they will kind of shoot it out, and it'll kind of appear like when you put pancakes on a hot griddle and you see that bubbling up that the pancake does. Manure does that whenever it hits the concrete for cows that have acidosis. So how do you prevent it? Gradual changes in feed, reduce stress by any way that you can do. Keep feed available all the time so they don't slug feed and eat a whole bunch at a time. Sodium bicarbonate, mineral oil, and penicillin are all great treatment options. And acidosis is oftentimes associated with a lot of other things, maybe bloat, liver abscesses, founder, which would be feet problems, and a number of other things. Peritonitis we referred to earlier. This would be when you have a perforation somewhere in the digestive tract most of the time, which causes then infection in the body cavity. Treatment, is again penicillin or antibiotics of some kind. And clinical signs, you'll usually see a rather high fever associated with this and a rigid stance. We talked about this one in the swine unit, so we will skip on ahead from this one to keep time moving here. Displaced abomasum is one that you will find in dairy and beef cattle, but it's fairly common in dairy cattle. I think the industry number right now is about 5 to 8% of all dairy cattle will exhibit a DA at some point in time in their life in the United States. It's usually caused by low fiber, high grain, high carbohydrate diets associated with low rumen pH, so acidosis type conditions, maybe a mixing error, you added the wrong amount of feed at a time, and a number of other diseases we'll talk about, and most of those in later segments of the lecture here. Symptoms, they'll lose a lot of weight really, really quickly. They'll be low on milk production and probably stop eating. So detection is done by putting your stethoscope on and kind of thumping the side of the cow, right kind of in the middle to the back third of the cow, and you'll hear a ping sound because there's gas built up in the room in the abomasum, which is now floating out of position. The abomasum should lay basically down by the belly on the bottom side of the cow, and a DA will float either to the left side or it will twist and float up on the right side of the cow, up towards the midsection or mid-level, or even up almost to the spine. These typically require surgery to treat, and then high levels of antibiotic to help them get over it. Next is bovine viral diarrhea. Back up a slide here. Bovine viral diarrhea is caused by a virus that's usually spread via dirty equipment, other vectors, which would be rodents of some kind. Other cattle can bring it around. But you have usually pretty high fever, somewhere in that 103 to 108 range in the early stages of the disease. Some respiratory type symptoms, some digestive type symptoms. And then if you have cattle that are pregnant in that day 58 to all the way up to 7 months, you can actually see abortions, which is, of course, quite problematic. And the symptoms tend to run in like 2 to 6 month cycles. So they'll have the symptoms for a while, and then they'll seem to kind of suppress them, and they'll appear to be more like normal, and then they'll break out with symptoms again 2 to 6 months later. And they'll kind of cycle back and forth like that. And if you're tracking them, BVD-positive cattle will usually have about a 10% mortality rate, so much higher than most of your normal ones. This one can be treated or can be fought off with modified live virus or killed vaccines. So you can administer those to help prevent this type problem. I highly recommend that. And then biosecurity, just keep your risk factors away for treating, for preventing BVD introduction onto your operation. Other treatment things, antibiotic for supportive therapy, keep them hydrated, of course, since we're dealing with diarrhea. And if you positively identify a BVD cow, she's probably one that needs to find her way onto the coal list and get her out of your operation, eliminate that risk factor. So I jumped ahead just a little bit, but you know by now it's time to catch a break. That will wrap up our first segment in this 4-segment mini lecture series. Take a pause, get a drink and a cookie, and we'll see you back for segment 2 in just a little bit.